Now at 4:12 News, recognizing Hispanic Heritage Month, and today some of the health concerns plaguing Wisconsin's Hispanic community. Joining us at 4 is Shiva Bidar Siloff. She's the Chief Diversity Officer at UW Health in Madison. We want to thank you for your time this afternoon. And we want to talk about the Hispanic community as the fastest growing community in Wisconsin. What are the major health concerns?
Yeah, thank you so much. It's really important for me to be here during Hispanic Heritage Month to talk about this issue, right? Because the Latino and Latinx community is really seeing a huge amount of disparities. Some of the disparities that we see in the Latinx community here in Wisconsin are around diabetes and a high rate of diabetes among our Latinx community. We see also really a huge number of disparities when it comes to access to healthcare, highest number of uninsured individuals in our state. We see also higher presentation of all kind of other disease presentations, such as liver disease, kidney disease, and other kind of chronic heart disease conditions.
Those health disparities are major. What should people do to try to combat that?
So I think one, being aware, right, for the rest of the community to be aware of these disparities, and for the members of the Latinx community to also really talk about these issues of health disparities. And I think the second piece of it is the most important thing that somebody can do is to make sure that they're accessing healthcare, whether through insurance or through a community clinic, a federally qualified community clinic, and making sure that they really get those preventive check-ins that they need to have and not skip over things like mammographies and colonoscopies and other kind of preventive measures.
You mentioned diabetes as one of the things to be concerned about. Why are the concerns different than with other ethnic groups?
It's the prevalence of diabetes is really very high in the Latinx community. We see a much larger number of individuals that have diabetes. That is also the case in some of the other communities of color, but again, Latinx being one of them. And it is something that is also driven very much so by both kind of a genetic factor and also lifestyle and nutrition. And we know that as immigrants come to the United States, and specifically our Latinx community, actually the nutrition and the access to healthy foods gets worse. And so we see that some of the trends in higher rate of diabetes are really due to a lifestyle in the United States that creates more risk for diabetes.
And we know the healthiest foods can be the most expensive too. So thank you so much for your time and your insight. We appreciate it.
You're welcome. Have a good evening.
You too.